And when I did that, my supervising doctor looks over my shoulder, looks at the circumcised penis, and goes like this. The world just stopped. What's up, ladies and gentlemen? Dr. James here, and I've got a different video for you today. I'll be talking about my experience during residency, specifically my first circumcision performed as a doctor.
I take your little thing, see? I put it into this little hole here, and nip the tip.
So as a first-year family resident, our program is designed to have at least 1 half day of clinic every single week for the whole first year of residency. It's 3 years of residency, so for this first year, that's how it's set up. We see people from all ages. We see obstetrics, so cases of children before they're even born, right? We see children, we see adults, we see geriatrics, we see everything. And the good thing about our clinic is that we have a healthy mix of just clinical stuff that we can do, but also in-office outpatient procedures as well. So it's the evening before clinic, and I check my phone to see what are my patients gonna be like for the next day and what I'm gonna be dealing with. And I see that for the last patient on the list scheduled for my clinic day, I see a circumcision procedure. And it's not a visit, so it's a procedure, so they block off even more time for that. And I kid you not, it was a 5-day-old child. And just as an aside, for those who are curious, circumcisions can totally be done in the outpatient, aka outside of the hospital setting. Usually within the first month of being born, you could do it like no problem. No need to get fancy with like all the different machineries and equipment and anything like that. 10 to 20-ish minutes. Totally can do that in the first month of life. And actually most of the time that we spend in the actual like procedure time is actually just preparing the area, numbing it, removing any adhesions or anything like that, and rather than the actual like circumcision proper. So here's where it kind of gets a little interesting. There are 3 major techniques or ways that you can actually go about doing the circumcision. There's the Gomco clamp technique, which, long story short, you got a little bell-like structure which you put on the head of the penis, and then that allows you to cut around the bell. And essentially it guarantees that you won't cut the head or anything like that. You'll just remove the foreskin. So pretty good. That's like foolproof. It takes a little longer though. I remember in medical school when I did a rotation at a pediatrics office, that's the technique that they used. Interestingly enough, I was helping out a doctor in my pediatrics rotation just the week prior, doing that technique as well. So that was the one that I was the most familiar with. Then you also have what we call the plastibell technique, which is where you leave a plastic ring around the head of the penis. In around like 5 to 8 days, skin will just come off with the ring. It's kind of like the same principle of like clamping the umbilical cord. You just kind of wait for it to fall off after some time. And then thirdly is the Mogan clamp technique, which essentially is when you pull the foreskin out and then you clamp the foreskin just over the head of the penis, and then once you clamp it, you essentially cut the foreskin from there. So that one, in my opinion, is the most intense out of all the 3 of them. But honestly, all these techniques are widely used. And what I've seen is that it's usually what the doctor's been trained in doing. They'll just stick to that one technique usually and just keep doing that for the rest of their lives. So in my experience, just as a medical student and a freshly minted resident, I pretty much only saw the Gomco technique, the technique where you use the bell, you know, the very foolproof method. So pretty much that evening, I just researched all about the Gomco technique, you know, what kind of numbing medications you need to put on, how long you have to wait between clamping and whatever, and blah, blah, blah. I even took notes on my iPad, you name it. I was good and ready, mentally prepared for this Gomco technique.
Fast forwarding to the next day in clinic.
My supervising doctor came up to me. As a first-year resident, you always have to have a supervising doctor always being there, especially in a procedure setting, to guide you and to make sure that you're doing the right thing, making sure you're following protocol. She goes up to me and says, I only do the Mogan technique. Remember, the Mogan technique is the very brave one where you have to pull the foreskin and clamp just above the head. No bell or anything like that for protection. It is very quick and reduces the risk of bleeding though, so that's the pro. But just for me, I wasn't 100% mentally ready for that technique in particular. But long story short, I really didn't have a choice as to which of the 3 techniques I was gonna do, so I studied the Gomco, but it ended up being the Mogan technique. But also as an aside, up till now, I've only assisted in circumcisions and never actually done one myself. So any of these 3 techniques would have been new to me. So it really didn't make that much of a difference. And actually the numbing technique and the preparation of the area and all that good stuff is all the same. So FYI, for numbing, you just basically inject lidocaine at the base of the penis, and it'll numb the nerves going downstream along the whole penis. And then also what's very commonly used, which we used as well, is literally sugar water that's passed through a pacifier throughout the procedure, where the baby can just like suck on that, and like it is the nectar of the gods to them. It really helps with soothing, and if there's any pain, that will definitely keep their mind off the pain, if at all. So as I was prepping the area with beta iodine, making sure that the sterile field was sterile, I just saw this squirt of liquid just coming out towards me and I dodged it. And basically, long story short, the baby peed right in the middle of prepping the area. So we had to prep the area again. And then of course, went to do the whole timeout protocol, which you confirm the baby's age, the operation, what's gonna be done, doing the whole fancy surgical glove inserting technique, and making sure that everything is sterile. So basically the actual circumcision went on after that, which consisted of taking out any adhesions that would possibly be between the head of the penis and the foreskin, taking the foreskin out, putting that clamp in right above the head of the penis, which is the nerve-wracking part. And basically that causes like an injury to the blood vessels, and it compresses them so that when you wait a little bit and you actually do the cutting after the clamping, there isn't much bleeding after you cut and then remove the clamp, right? That's the idea behind that. So when you remove the clamp, you can finally see the end product, the circumcised penis. And when I did that, my supervising doctor looks over my shoulder, looks at the circumcised penis, and goes like this. The world just stopped and I was about to pass out. I was like, what did I just do? And then after 2 seconds, she turns and looks at me and says, pretty good. Basically, long story short, as a rite of initiation, she pretty much does that to every resident when they do their first circumcision. So, whew, the baby and the parents were happy, and we all lived happily ever after. And that's pretty much it. I know this was a different format, a different type of video, but I feel like it's nice to show a little perspective of what it's like to be a resident physician and to be in that unique situation. I hope you guys liked it. I guess moral of the story is that no matter how prepared you are to do things in one way, you always have to have that flexibility to also do things another way, because you never know when life can throw you curveballs. And with that being said, let me know if you'd like to hear more stories about residency and whatnot. And obviously, if there are any other topics you want to learn about in terms of just medicine in general, just drop that down below in the comments. Don't forget to like, comment, and subscribe. And as always, until next time.